Support comes from Soaring Heart Natural Beds, where concern for the health and safety of sleep now extends to everything from curbside pickup and delivery to secure in-store appointments. Showrooms in Seattle, Bellevue, and now in Edmonds, or online at soaringheart.com.
Hey, it's Patricia Murphy. It's Tuesday. This is Seattle Now. We're in phase 2, and that means there's a lot more physical gathering going on. That definitely increases the risk of COVID transmission. In a minute, Dr. Vin Gupta will tell us what the science says about how we can stay safe. But first, let's get you caught up. A Seattle area member of the far-right Proud Boys has been ordered to D.C. to face charges in connection with the January riot at the U.S. Capitol. 30-year-old Ethan Nordine was initially released by a Seattle magistrate, but within hours, a district judge in D.C. ruled otherwise. Nordine was arrested last week after being charged with obstructing an official proceeding and other crimes. He hasn't entered pleas to the charges yet. Microsoft is changing the way it handles political contributions. The company said that from now on, its PAC will donate only to politicians who act in favor of the promotion and preservation of democracy. It comes after a leak of Microsoft President Brad Smith speaking bluntly about how he uses political donations as a means to access politicians. Microsoft's PAC had previously donated to politicians who promoted the lie that there was widespread fraud in the 2020 election. And avalanche conditions are dangerous up and down the Cascades today, so be extra careful if you're venturing out. And we might be in for some snow in the city over the next 2 days. Even if we don't get any of the white stuff, it will be plenty cold. Forecasters say we won't get above 40 degrees for the rest of the week. Restaurants and gyms and schools are reopening all over the state, which should be good news. But the pandemic, it's far from over. On the plus side, more people are getting vaccinated, but we're still seeing thousands of new cases every day and fighting even more contagious strains now. Dr. Vin Gupta is here to help us wrap our heads around reopening in this moment and what we can expect over the next few months. He's a public health analyst and a pulmonary specialist at the UW Medical Center. Dr. Gupta, thanks for taking the time.
Thanks for having me.
So interestingly, you consulted a bit with the Seahawks on their COVID plan, and they were the only team in the NFL without a COVID case, which is remarkable. Tell me something you learned from that experience that might apply more broadly.
First, doing what the Seahawks did, and I played a small bit part in it, but doing what they did took a lot of time. It took a lot of resources, financial and otherwise, human resources, to actually pull off mitigation efforts successfully. I think people, especially as we talk about safe school reopenings, hear from the CDC and others that, well, if you have certain measures in place like testing and safe social distancing, masking, among other interventions, that you can open any sort of public space safely. But it's a lot easier said than done. And the Seahawks, to their credit, to the credit of Coach Carroll and his staff, were able to implement a lot of science-based interventions when it came to distancing, when it came to safe ordering of food, and then ultimately what I helped on, which was rapid testing frequently, to keep that organization, their facilities safe. But that took time, that took investment, that took clear crisis communication from the very top. And as a result, I think you saw player buy-in, staff buy-in, and all those ingredients are really vital.
Yeah, I think that's such a great point, because at this point in the pandemic, it's so easy to just let the news and the numbers wash over you. And I'm curious where we are in this pandemic.
We're still in the thick of it, and it's hard to wrap your head around that reality and depending on the day, if you look back over at least the last 4 weeks, we've lost anywhere from 1,500 to, in some cases, upwards of nearly 5,000 people a day, and we're numb to it. Sometimes it's not even breaking one of the top 3 stories given the day, and I mean, that is an astonishing number that we've become used to. How do we contend with it? How do we mitigate the loss of life while we're ramping up vaccination? That's where we find ourselves in a really interesting spot, where there's a lot of dissonance in public policy right now. And that's causing confusion. And I think that's eroding and continues to erode public trust writ large, where you're seeing, on the one hand, citizens across the country are hearing, please potentially now double mask in the setting of these new, more transmissible variants identified overseas. Maybe minimize even how much time you're spending in a grocery store. Certainly don't have people over for the Super Bowl or for intimate dinners like your neighbors. Avoid all those things, and there's an evidence base around that, or an emerging one. But yet at the same time, we feel comfortable to say indoor dining with restrictions is okay in at least 48 states. That going into schools without vaccinating high-risk teachers and adult staff is okay if mitigation efforts are in place. Again, a big if. There's that dissonance there. It doesn't actually make a lot of sense when you think about that.
Schools and businesses in the state are beginning to reopen. Some kids are back in the classroom. We can have limited indoor dining. Now, given all the things we've just talked about and your uncomfortableness with moving forward at this point on some levels, what are we likely to see in terms of case counts?
Opening schools, allowing indoor dining with restrictions will increase the movement of people, whether it's children going to schools and meeting adult staff for in-person learning, or having dinner with their neighbors at a restaurant with restrictions. Movement will equate to increased transmission, increased caseloads. Whether that ultimately results in hospitalizations rising and deaths increasing, well, that's where vaccination comes in. And we know that vaccination will protect us against the worst impacts of this virus, meaning ending up in a hospital, on a ventilator, and passing away from this virus. That's the importance of vaccination. That's our way out. But let's not fool ourselves in thinking that opening up segments of society is not going to result in increased cases. We know that we are underdiagnosing the true incidence of this virus. We've had the CDC say that for every one confirmed case, there's 10 unconfirmed. So let's acknowledge the fact that mobility and the fact that we're re-engaging as this virus remains out of control is only going to result in increased transmission.
Will this be a test of our vaccine effort at this point then?
I suspect you're going to see that we're going to have heightened loss of life. So more people likely will die right now than they otherwise would have if we remained virtual, for example, when it came to schools, or if we didn't have indoor dining. So this is a trade-off, and let's just be frank about that. There is a trade-off happening here, where as we continue to loosen these restrictions and increase mobility, that what every single model has taught us is that will result in increased cases and hospitalizations until vaccination is where it needs to be from a herd immunity standpoint, and we're nowhere near that at the moment.
Let's talk about schools for a minute, because this is such an unforgiving situation on both sides. Kids being home is obviously not good for them or their mental health, their learning, but reopening buildings is also risky. You said earlier that schools need to use mitigation strategies to reopen safely. What kind of things are we talking about?
Well, I'd like to see teachers wear and have access to a constant supply of high-quality masks. We've been having the most non-substantive of debates on should you put something on your face or not what about the quality of mask that you should actually be entitled to. And so in a perfect world, you want a mask that's high enough quality and yet comfortable enough that somebody would be willing to put it on their face for an extended period of time. In the absence of that, I'd like to see teachers at least wear a 3-ply medical type mask that ideally has head ties, but some variation on let's get a high quality mask that's well fitting using existing equipment is vital. Obviously, a great hand hygiene, frequent hand hygiene is going to be vital. And making sure that we have lowered densities of children and staff in any particular in-person indoor location for the time being is also going to be really important, meaning hybrid learning environments potentially for the time being until vaccinations are really at scale, at least for adult staff.
I keep coming back to how tired people are. You know, we're emotionally fatigued. I wonder how much this fatigue is playing into our willingness to participate in risky activities at this point.
I'm sure it is. And that's why in an environment where we didn't have a vaccine or an effective therapeutic, what have we been talking about? We've been talking about risk reduction. Risk reduction is something everybody wants to engage in because they want some sense of normalcy. How can I do what I want to do, but safely? Let's be honest, we all are somewhere on that continuum for the reasons you mentioned, which is it's really darn tough to continue to do what we're doing. It's not sustainable. So how do we get people to continue to comply with masking, distancing, you name it, for a shortened period of time? I think it's giving them hope that this vaccines are a way out. What we need is everybody to message clearly to all demographics that this vaccine will let you normalize your life more quickly. Any vaccine, all vaccines. We need to have a broadened approach here, a think big approach here about how we market on this, because right now it's just not good.
Dr. Vin Gupta, really good to talk to you. Thank you for taking the time.
Thanks for having me.
Seattle Now is produced by Clare McGrane, Caroline Chamberlain Gomez, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.